welcome to Vitals Academia with New York Medical College's BINGAP chapter. I'm Angelique Boyer, co-president of NRMC's chapter of Building the Next Generation of Academic Physicians, BINGAP, which is a national organization that aims to help underrepresented groups become aware of academic medicine as a career option and provide them with the resources to further explore and potentially embark on academic medicine career. Vitals of Academia is a new podcast that aims to highlight the careers of academic medicine physicians and demystify the process for how they built their careers. Today, I have with me Dr. Leah Habersham, who is an assistant professor at the Icahn School of Medicine at Mount Sinai, holding primary appointments in both the Department of Obstetrics, Gynecology, and Reproductive Sciences and Psychiatry. As a dual board certified OBGYN and addiction medicine specialist, Dr. Habersham leads the Bridge program, an innovative initiative providing integrated obstetric, gynecologic, and addiction care. Her research is centered at the intersection of maternal health and substance use and use disorders, with an additional emphasis on inequities. Dr. Habersham has authored peer-reviewed publications and is recognized for her contributions to advancing equitable and compassionate care for pregnant and partnering individuals with substance use disorders. Thank you so much, Dr. Habersham, for just joining us today. Really looking forward to this interview and just kind of seeing more about your experience and what led you to where you are now.
Yeah, thank you for having me.
Awesome. I guess just to kind of like start off, can you tell us a little about your journey and kind of what inspired you to become a physician and enter medicine at all?
Yeah, so I guess how far back would you like me to go? Just to medical school or?
Yeah, I would say to medical school unless there was like something really pivotal beforehand that you wanted to share too.
No, well, I always knew I wanted to be a physician. I really was interested in being like an OBGYN delivering babies. Um, I didn't quite think that that would happen. I ended up at an overseas medical school only because I wasn't gonna go. My daughter's father at the time, he was applying to medical school overseas, and I figured let me just try. And so I applied and got in. And because I went overseas, I never really thought that academic medicine would be something that I would even be able to go into. And so as I, went into my career, I ended up doing OBGYN. I was at a community hospital, so I really didn't have that academic university experience. But then after practicing for about 5 years and having experience as a clinician in the field, I saw that there was this gap in care specifically for people who had addiction. And were pregnant. Really, nobody knew how to care for them. Maternal fetal medicine wasn't really well versed on that area. And addiction medicine, they really weren't comfortable with treating pregnant people. And so I realized that this was something I wanted to pursue, and not just pursue clinically, but I wanted to advance that field and push it further. Having had a dad who like struggled with addiction, I knew that patients can come out of that, they can enter recovery, and I wanted to help patients to realize that because that was something I really envisioned for them. So that's pretty much what led me to this area, and that's what led me to academia.
Oh, that's really interesting. Because I was going to ask you, like, how did you kind of bridge psychiatry and OB/GYN? Because that's a pairing that I feel like you never really hear about. And I don't think students know sometimes that you could even have these dual appointments if you have these diverse interests, especially because you started off in OB/GYN and kind of like transitioned over into like including those additional specialties as well. That was really interesting. Was it hard to kind of like get dual sort of certified in those things and kind of like expand your practice to kind of meet those interests? Did you have like a lot of resistance that you felt, or was it just kind of hard even taking those steps?
Not many people know about this area of addiction or of OBGYN. And so they don't know where to put you. Like people want to put everyone into a box. Like, okay, you're an OBGYN. And then if you're an OBGYN, there's room for you to be REI, infertility specialist, or to be like an MFM, but there's nothing else outside of the few areas, subspecializations. And so if you have an interest in something, it is possible, to veer off. You don't always have to stick with what everyone has done. And so doing the research, I think academia is somewhere that appreciates having this unique experience, and this unique niche area, because there aren't many. And so, and especially with such an important area, like um, with the overdose epidemic as it is, people want to have specialists in this area, especially with maternal mortality. The leading cause is, for pregnancy associated deaths, it is overdose. And so, or that's one of the leading causes, is mental health conditions, with overdose being the primary of those. And so you just have to realize that there is a space for it. And though people may, want to box you in, and they may say that's not really possible for you to do that, you have to do your own research and figure it out yourself.
Yeah, I think that's like a really great point about like just doing your own research and making sure that what you're doing, you don't have to necessarily fit the mold. You just have to make sure that you're doing what follows your passion. So that's
Yeah.
really awesome.
Yeah.
And then I guess kind of going along with that, were there any, I guess, specific, I think you mentioned a little bit about just like, people wanting to fit you in a mold, but do you think there were any other barriers that you felt that you had to endure, in building your career, especially with trying to do something that most people didn't really understand?
For sure. So I was very concerned about the fact that I went to an overseas med school, right? Like because I figured, Mount Sinai, it's this big academic institution. There's no way I can end up there. But really, nobody cared about that. But they did want me to have experience in research. And they wanted me to have experience writing papers and knowing statistics, biostatistics, and things like that. And those were things I didn't have any background in. I had a mentor who connected me with different programs as I started out. So from the time I landed in my fellowship, I made it clear that I wanted to do research in this space. And I sought out a mentor. I think that's a big thing that you need to do, is seek out a mentor who's already doing the work. And then not necessarily in your field, but who's doing research and has experience and who can support you. And so then I was able to get into a T32 where they funded my master's in clinical research. So I was able to get all those skills that I didn't have. And having the mentor that I had, she had the resources to help me to obtain like data and start doing, as I was learning how to do analyses through my master's, I was able to start doing projects and getting published and things like that. And so basically I started from the bottom and just built my way up. And it's difficult because going backwards, like I was already making, like attending money, and to have to go back and do a fellowship after 5 years was like, but it's a sacrifice. And if it's something that you really want, even after starting your career, it is possible to do.
Mhm. Wow, that's really great. I like how you said like, the mentor kind of was like finding mentors that will really help you where you want to go. But yeah, I can also not imagine going back to fellowship afterwards and just kind of like that mental struggle of, do I want to go back to training and kind of like, take a seat back from, where you were, even though it's for what you ultimately wanted. So that definitely sounds difficult. And I also really like the fact that like you didn't have that like statistics training in your med school, but you still did it, kind of just, I think, showing like all students that even if your school doesn't provide the tools you want, you could still kind of go back and get it. You don't have to worry about not having adequate training where you are. You could still like end up where you want to be. So it's really great to hear. Yeah. And then I guess just because you talked about mentorship, just kind of like go on that for a little bit. Like, how would you suggest students find mentors, especially if they're looking for a mentor in a field that might not necessarily exist or be, as prevalent as like other ones. Like I know for you, like having that, that was like hard finding someone that did what you wanted to do. So how do you suggest building those relationships and finding those mentors?
Um, I would say the cold calls works sometimes. It does. The mentor that I was linked with is Yasmin Hurd. She's huge in addiction. She is not huge in OB addiction. That's really not her area. But because she has a well-established career, she has many connections, many resources, it didn't really matter. The other thing that I thought was that I needed to have a mentor that was a physician, and she's not. She's a PhD. And that was, like that, I guess, a misunderstanding coming from the world of medicine. I thought that that's how it works, that you have to have an MD or an MD PhD who is your mentor. And I realized after entering the field that it's not like that, like research and academia is not necessarily like that. And so being open-minded, being a go-getter, like reaching out to people, sometimes people don't respond. People are very busy. And, like I used to think, oh, researchers just sit around all day, maybe they'll write a paper here and there, but they don't really do much. I work more now than I ever did as a clinician. Like I
Mm.
work, but I mean, I'm working, it's a different kind of work, right? But yeah, so people may not respond to your emails, but if you see that there's someone or a few people, I would identify a few people that are doing the work that you're interested in, like finding papers on that topic and reaching out to the people that are either the first author or the last author, just so that you can start to build those connections. Actually, the person who I would say is like the gatekeeper for this field, not in a bad way, but he's like it in this field is Mishka Turplin. He's an OB and he's also an addiction specialist. And so he actually reached out to me. I forget how he heard of me, but he reached out to me offering to be my mentor. And so sometimes that happens too, And I think it's something to keep in mind as we further ourselves in our careers, to always think about reaching back to others, because sometimes people, I did want to reach out to him, but I was like intimidated. I was like, oh, I'll wait, and then he ended up reaching out to me. So, and that's another thing that actually now I remember how he reached out to me. It was because I told someone else I was like, he was the person that I wanted to become in terms of research, and they told him, and that was how he reached out to me.
Oh, that's so nice. It's so nice that like he did that because I think sometimes people wouldn't. But it's also really, I think even empowering to like, I'd never thought about like, oh, let me just look at who writes these papers and like just reaching out to them kind of that cold turkey. But I guess like it could work. Or even if just like kind of putting it out there that you want to connect with someone could still work too. So that's really awesome.
Yeah, in academia, it's very easy to get people's emails because
Mm.
they're usually on their webpage on the university website. And also when you look up articles, the corresponding author, you can reach out to them.
Yeah, awesome. That's really empowering to hear, I think, for students. So great. Um, and then I guess kind of just like along your whole like career, like in building it, or do you think there were any specific skills or attitudes or just like knowledge that you found to be really successful or helped you to be successful in building your career?
I think the fact that I'm always really determined, I don't give up. Like even if I'm hit with tough situations and I fail at something, I still keep going. And that's what you have to be in this field, because there are going to be a ton of no's. See, I guess academia and research are, they can be the same, but they can also be different. Like you can be an academic, be in academia and not be a researcher. But in the field of research under academia, um, there are a lot of no's. Like when you're applying for grants, you're going to get rejected all the time. You're going to submit papers and they're going to get rejected all the time. And it's like, maybe 1/3 of the times things will get accepted or you'll get awarded a grant. And so you have to build a thick skin, and that's easier said than done. It still breaks my heart every time it happens when I get rejected, but it happens, right? And I think you're better for it when you're able to push past that. And so just continuing to push forward and making sure that you're doing this for the right reasons, right? That you enjoy the work that you're doing, because if you hate it, you're not going to stick with this, right? You have to really um, be passionate about whatever it is that you're doing. And I think also being willing to pivot, right? Like now, you can't talk about inequities anymore. So it's like now like a dirty word to talk about inequities and DEI. And so you have to be willing and ready to pivot. So I hope I answered your question, because now I feel like I forgot what the question was.
Yeah. No, it definitely did. Yeah, just kind of like the mindset that you found was like helpful to, have the career that you're doing. And yeah, I think like just the acknowledging that it's okay to get a lot of no's and kind of getting used to them and even preparing for them is great. Because I think a lot of times we get a no and we think this isn't for me, but really sometimes it is for you. You just have to keep pushing past that. So that's awesome.
And actually, you get a better product, not to belabor this, but you get a better product when you get those no's, because a lot of times those no's will come with corrective, like criticism, like stuff that you can change about it. Like maybe they'll say, this is important work, I just think you need to make it better. And honestly, when you're publishing something, don't you want it to be like really the best work possible? So sometimes it is helpful to get those no's so that you can improve yourself and what you're doing, and maybe have a better grant proposal that will really be more meaningful and impactful once it's awarded, you know?
Yeah, that's true. That's a good way of looking at it too. Like the no's are really just really giving you the feedback you need to make a better yes one day. Versus if your first no was approved, it probably wouldn't be the quality that you really want it to be. So that's awesome. Okay. And I know you mentioned a little bit about like the health inequities and having to pivot a little bit. I don't know if you could just talk a little bit about that too, especially with the changing landscape. There's a lot of things now, especially with like some of the executive orders, and there's a lot that's being talked about with DEI and health inequity and what can or can't be done. So, how has that affected you, and how have you found like navigating this new field has been?
Yeah, so it's really unfortunate. Um, Very unfortunate, because the grant that I was actually on that supported my salary, because really that's how it works with research. If you're going to be a researcher, um, you have to support yourself. So the grants that you bring in, a portion of those grants pays your salary. And so I was on a grant that covered 80% of my salary, but it was a DEI grant through the NIH called NIH First. And so that grant ended. We actually just got a termination letter this week. And so, but we knew it was coming because of everything going on, but still, so now I don't have that support anymore. Fortunately, my institution, they'll still support us as a group. But it's just unfortunate. And then I had another grant that had nothing to do with DEI, and the state terminated it because of the cuts that were made at the federal level for state funding that had to do with addiction and infectious disease.
Oh wow. I didn't realize that they were also doing tests for infectious disease and addiction in general. I feel like that's surprising, especially with what just happened with the pandemic a couple of years ago. I thought infectious disease was a little bit more getting more attention, and now it's seems like it's not. So
Actually, that's what's fueling their cuts, because they don't like what happened with COVID.
oh, that is interesting because the only reason why we're able to return to where we are now, I thought, was because of the research that's being done. So that's very disheartening. Yeah.
Yeah, so I would say that because of these changes that have happened, um, yes, I have to pivot. And so I've taken, the work that I do at that intersection doesn't have to be focused on inequities. I mean, the whole population that it deals with pregnancy and postpartum and also deals with addiction, they are a disadvantaged group within themselves. Forget about race, you know. So I'm completely fine with just studying that group as a whole. But it's unfortunate that I can't also have that additional layer, because it is an additional layer that increases the disparities that we see. But again, it's all about pivoting. And the other thing that is important, what was the other thing I wanted to say? There was something else I really wanted to make sure I brought up, but the other thing is that it's really nice being a physician too and a researcher, because there's always that you can fall back on. If you can't support yourself anymore as a physician, you can always do more clinical work. Whereas, you know, with my PhD colleagues, it's not always that easy. They may be able to do teaching, that may be an option, but it's not always that easy. So we are in a better, I don't want to say better, but there are some advantages to being a clinician scientist as opposed to just a scientist that's not a clinician.
Mhm. That is true. I guess we do have like that blessing if you are MD as well or a DO, you're able to still like see patients and kind of make up, I guess, your funds that way. So I guess then if there are any students who might be interested in like DEI or health inequity, just in general, now they're might be a little bit more scared. I know we mentioned pivoting. Would you say that, well, I guess what would your advice to them be? Like, would you say like it's best to kind of pivot into something else, or just find a way to like merge your interests? Like, what advice would you give to someone who did have interest in those fields?
I don't really have good advice. I think what you have to do is cover the topic still. So whatever, I mean, most people that are doing inequities, they're focused on a specific area of inequities. So you have to go more higher level. I mean, of course, still you're in your research as you're uncovering research, and you know, you make like you look at confounders and things like that. You're going to look at race, you're going to look at socioeconomic status. And so those things will come out in the research, you know, but you just can't make that the topic um, of your research. Like you can't state that this is what I'm trying to research. And I don't know that I should be saying that because but that is what it is, and that's how it is now. And one thing I learned when I was doing my master's, there was a gentleman, he was African American at Columbia. I don't remember his name, but he was an older gentleman who was in SNCC back many years ago in the civil rights time. And I remember him saying that, you know, you are limited in research. Like you can only study what they will let you study. You cannot just pick a topic because you're not going to get funding. You know, they're not just going to give you funding for anything. It's only going to be topics that they approve. And this is before anything with this new administration, way before even Kamala was running. But I remember thinking, wow, that's true. And now I really understand really and truly what that meant, like the depth of that, because now we can't just study whatever we want to study. And so you have to realize that as a researcher, you know, and some people do research because they like the art of research, but some people do research because they're passionate about it, right? Because they're passionate about the topics that they're studying. And so I don't think if I could not study my topic anymore, I don't think I would want to do research. You know, this to me is something that I pursue because I really enjoy it and I'm interested in it. And I'm glad I have my clinical work that I could always fall back on.
Yeah. I guess that's like a really good point. Like you could only research what they allow you to research, or you know, I think everyone research is like a really hot topic, but it is very limited too, unless you have like a private investor that would like to support your project. It is what I guess it's whatever the money wants to pour into it, which is, I guess, a sad reality because sometimes I'm sure there's a lot of good research that can't get supported just because it's not as popular or doesn't get the highlight and the support it needs. So that is
Yeah.
yeah.
Yeah, I don't know if we have, I won't. If we have time, I can say it, but I don't want to hold up.
I mean, you could go ahead and
I remember meeting a gentleman who he was a PhD and he had this interest, I forget what it was. I think it was about like using cannabis and how that had something to do with your eating habits or something. This was his area of interest, but he could never get funded. And then he finally just did what the like he moved his research towards what they were looking at that point. I think it was, I don't know, using cannabis for like medical treatment or something. It wasn't his passion, but it was just what he saw. He kept seeing um uh uh funding opportunities for that. And so when he finally pursued that, he finally got funded. And so it just proves the point of that you can't just study what you're interested in. It can't just be this great thing that you just think is awesome and nobody else thinks it's awesome. It has to be something that other people find important too.
yeah, good research doesn't mean that it's going to get funded, unfortunately. So that's very sad. And then I guess to that point, I mean, I guess you talked a little bit about before, like if you couldn't research what you were researching now, you would probably just go into, I guess, clinical medicine. I guess just like in general, like do you, and I know you're at an academic institution, like have you ever thought about leaving academia to do private practice or I guess, leaving research in general just to do clinical medicine, and kind of like what's kept you on this like research academic path?
Yeah, I have thought about going back into clinical medicine, especially now with everything happening, things kind of falling apart in the research world. Um, Even if it's just to get back my skills, because it's very difficult to do both well. Like especially when you're a surgeon too, because OBGYN is a surgical field. So I haven't done a C-section in several years. And so with everything happening the way that it is, I was very concerned and was starting to look into taking calls again, just so I could get my skills back. And I think that that's definitely something I've thought about because that is my fallback is my clinical skills. But I have an integrated clinical program, so I am still able to, my research does bleed into my clinical work. And so I have an integrated OBGYN addiction program, so I get to help this population. But yeah, doing more of the clinical work, definitely a consideration with everything that's going on.
Yeah, that definitely makes sense. It's good to have like multiple plans kind of in place or know what your plans could be even if you don't do them. Awesome. And then I guess just some of our last few questions. What would you like to hope to leave as your legacy in academic medicine, for your specialty and for any like mentees and students who are hoping to follow in your stead?
Well, first, I think the example of the the less walked path. I don't think that's the right term, but I think you get the point. So that it is possible, right? Like I didn't think that this was possible. And the fact that I am a testament to the fact that this is possible to go down this path, even though I didn't come from, like a top institution or even a US institution, right? Then in addition to that, in terms of the body of work, I want to push this field forward for the population, for women with substance use disorders. The biggest gap that I see is the lack of education of women's health providers in this area, like just understanding even basics, like how to identify substance use disorders amongst pregnant people and postpartum people and how to do basic management. I don't even mean prescribing medication, just like where to even send them once you identify them. And so I want to make that information and that research surrounding that digestible for my colleagues. And so I hope that whatever work I actually get to complete and do during this time, that, that is done at the very least. That's my hope.
That's awesome because yeah, not even knowing where to send your patients is like a huge issue. So yeah, just making it more accessible. That definitely sounds like it will benefit a lot of people. So that's awesome. And then I guess we're just winding up, unless there's any last advice you would have for students who want to enter an academic medicine career, don't know where to start. Just like what parting words or advice would you have for any students?
I think it's important to find an area that needs researchers in that area, finding something that not everyone is doing, finding like a niche is very helpful. It makes your life much easier. And then seeking out mentors, always cold calling people, look at the papers that you are interested in and reach out to those people. A lot of times, not always, but a lot of times people will reach back out, and even if you don't keep in contact with them forever, maybe they can point you in the direction of someone else. That's really helpful. And just don't give up. Just be determined and stick with it. If this is what you really want to do, it is possible. Even if you're someone who was practicing for several years like me, it is possible.
Awesome. That is definitely great to kind of keep in mind, just keep pushing forward and knowing that it is possible. So awesome. Well, thank you so much. It was great having you on. This was a great episode, and I know it definitely will help a lot of students, especially ones who might be thinking about non-clinical work and try making that transition. So thank you everyone for joining to our episode of Vitals of Academia. Make sure you subscribe to see when we have future episodes coming out, and look forward to seeing you at our next episode. Thank you so much.
Thank you. Bye-bye.